Hi there, Kendra Tolbert here. I'm a registered dietitian and yoga teacher, and I specialize in women's health and fertility. And today I have an interview for you. I had the great privilege of interviewing Dr. Kenael. Dr. Kenael is a pelvic floor PT, so she specializes in the pelvic floor and she's a physical therapist. She answered so many of your questions about how physical therapy can play a role in preconception care, prenatal care, postpartum care, and just overall well being. I'm sure that you're going to really enjoy this interview, so let's get right into it. Thank you so much for being here with me. I'm super excited for everyone to meet you. So that's where we'll start. Go ahead and introduce yourself. Who are you in your own words?
So I'm Dr. Kenael Segal, and I'm the owner of my own pelvic floor practice in New Jersey. It's called Lotus Physical Therapy and Wellness, and I'm a mom of three. I am a wife and Pilates instructor, and soon to be yoga instructor as well. So that's really fun.
All the things, all the things. I love it.
All the things.
So, for those of us who aren't so familiar with it, can you tell us what pelvic floor physical therapy is?
Yeah, so a lot of people aren't familiar with what it is. And, disclaimer, I did not know what that was myself even when I was in PT school. I was like, oh, women's health physical therapy is what it was known or how it was known to me. And they've since shifted that term or the name to pelvic floor physical therapy because women's health physical therapy normally encompasses, prenatal postpartum conditions or conditions that affect women, specifically their abdominal and pelvic floor region. And the shift is to call it pelvic floor physical therapy because men have pelvic floors too, and kids also have pelvic floor, and they also have pelvic dysfunction. So, hence pelvic floor physical therapy. So, the conditions that I am normally treating might be, as I mentioned, prenatal postpartum conditions, but also anything that applies to men pelvic floor wise. So, that might be any sort of incontinence. So, whether it's bowel or bladder, and constipation, another bowel dysfunction, as well as sexual dysfunction. So, pain with intercourse, pain with penetration, um, pelvic pain in general. So, like the pelvis, like the muscular or the bony structures. So, anywhere in the low back, it may be tailbone pain or pain at the pubic symphysis, anything related to the hips, it sort of falls in that category as well, in addition to abdominal conditions as well. So, diastasis recti is probably the
Mhm.
most common one that everyone knows about. It's just a fancy way of saying abdominal weakness. So, any sort of weakness or dysfunction related to the abdominals and the pelvic floor, whether that be bowel and bladder control or sexual dysfunction, is all under the realm of pelvic floor physical therapy.
Oh, wow. So, would someone need a referral to see a pelvic floor physical therapist?
It depends on where they live.
Okay.
So in New Jersey, anyone can call me and walk through my doors. And that's because of a thing called direct access,
Mhm.
where you can pick up the phone and call a physical therapist, make an appointment, and show up. Whereas in some states, you might not have direct access. It may be some form of direct access, but that might mean you need to go through your primary care doctor first to get a referral in order to see a pelvic floor physical therapist. So it depends on the state. So if someone is thinking they need pelvic floor physical therapy, it's best to probably just pick up the phone and call the physical therapist and ask, do I need a referral or a prescription to come seek your services? And you'll get your answer there.
Okay. Really, really good to know. Yeah, because I think in Texas you have access, but if treatment goes beyond a certain number of days, then you need a referral. And I know it seems like it's different in every
New
state.
Jersey's like that too, technically. Like if it's beyond 30 days, there needs a referral. But a lot of what ends up happening is most of the patients that I see, they don't have a primary care, especially if they're women and they're postpartum, like mm, they don't go to the doctor regularly because who has time? Because they have kids, right? So like they're not going to the doctor yearly, and the only doctor they're going to is the OBGYN or the gynecologist. They can provide a referral, but technically after 30 days, if there's no improvement or even without, I'm supposed to get a referral or at least follow up with the doctor, but I'm usually in touch with a urogynecologist, midwife, the anyone really. I'm really in touch with those doctors anyway because I'm sometimes referring them to other people, so it works out. Texas is probably like New Jersey.
Gotcha, gotcha. Okay, good. Now, you started off by mentioning the different conditions. Is pelvic floor PT ever used as preventive sort of treatment, or is it only if something's gone wrong that someone should go see?
Girl, I wish it was prevented. It can be. I try to encourage my patients, especially the ones that are discharged. I try to encourage them to come back for a checkup, just as you would go to the dentist twice a year, or you would go to the gynecologist for your routine checkup, once a year or three times, once every 3 years, whatever schedule your particular doctor's following. I try to encourage them to come back to PT, like because they're coming for a condition to begin with. So I might say follow up in 3 months if you're feeling okay, maybe 6 months, maybe 9 months, or maybe a year. And it should be more of a preventative thing. I do have a lot of patients who come now, thankfully, during the prenatal phase. So before they give birth, they come for a consultation, and it's really just like a birth prep. We go through positions on how to birth, positions on how to best protect the pelvic floor, breathing techniques to best protect the pelvic floor, what to be aware of in the postpartum phase to know when a pelvic floor physical therapist or a doctor may be warranted right away. We go through all of those, and I'm getting a lot more of that recently, which is great. But I wish I can catch people even before that. Like while you're trying to conceive, come to PT. And then when you're pregnant, we can do prep for birth. And then in the postpartum, we can see how things are going. I'm also getting a lot of patients who come postpartum because they're like, I just had a baby and I want to make sure everything is okay. I'm like, yay, that's great. That's when you should come.
Lovely, lovely.
Most patients do still come because something's going on. They have an issue.
Gotcha, gotcha. Okay. So hopefully more preventative care will be happening and hopefully more and more in the preconception world. Because it seems like people are becoming a lot more aware that like preconception matters as well. So fingers
Yeah,
crossed.
I know. I think people are waking up to it. There's a big influx in the amount of people that are getting treatment for pelvic dysfunction and a huge influx in practitioners who are also treating pelvic floor dysfunction. So the people are there to help. So people more and more people should do it.
Good, good, good. Okay, so now we're going to dive right into subscriber questions, and we got pretty good amount, and I'm excited to hear your thoughts on them.
Yeah.
So, first question: what are some ways to release tension and increase pelvic floor circulation at home?
Ooh, I like this question. So there's a number of things that can be done, to release tension in the pelvic floor is the same as releasing tension anywhere else in the body. You first have to have an awareness of that tension. And then I like to say, send your intentions to that area and breathe into it to try to relax it. So, breathing is one way of relaxing the pelvic floor. And not just because breathing is good for relaxing the body in general, but because breathing literally moves the pelvic floor muscles. So, people describe it as a piston effect. So, the diaphragm on top, the pelvic floor on the bottom. Are people watching? People are watching, right? This is video. So the diaphragm on the top, the pelvic floor on the bottom. When you take an inhale, the diaphragm moves down, the pelvic floor has to move down too. So simply by breathing, you get movements in the pelvic floor muscles, and that can release tension. And then another way is stretching the muscles. It's easy to stretch a bicep or a leg muscle because it's attached to bone and you can move that bone in order to stretch it. Pelvic floor muscles a little bit different because you can't move your sits bone. They're just there. You can't move your pubic bone or the tailbone, which the pelvic floor muscles are connected to, but you can still stretch other muscles that are connected to those same points to indirectly stretch the pelvic floor muscles. And just by sitting in a squat or sitting down into a squat type position or like a child's pose, any hip openers are great for pelvic floor release and breathing into it. Again, just the natural movement of the breath and the movement of the pelvic floor muscles. That's a great way of releasing tension. And stretching can actually build muscle and increase circulation as well. So that's a good way of getting all of that in the pelvic floor. And then another way of releasing tension, similar to how you would in any other part of the body, is by fully contracting the muscle, fatiguing it, and then relaxing it and allowing it to let go. You can do that with the pelvic floor as well.
Hmm. So we have another question coming up on breathing, but I kind of feel like this is a good segue. Um, and I personally have the question: does it
Yeah.
matter the type of breathing? Like if someone tends to, I've seen this where people inhale and it's like they suck in their stomach rather than kind of allowing it to expand. Would that have a different effect on the pelvic floor?
It does, yes. So the breathing primarily that I teach for bringing awareness and connection and releasing tension in the pelvic floor is diaphragmatic breathing or lateral costal breathing or 360 breathing. I use them interchangeably. And all it means is that you expand the ribs, allow the diaphragm to drop, which allows the belly to expand, which allows the pelvic floor to drop. And even if you're working on strengthening the pelvic floor, you have to get a good breath in and a good stretch or length in order to get a good contraction. So that's the breath that I typically use. And I do see patients come in with that breath pattern where they inhale and they suck in.
Mhm.
And yeah, it does shorten the muscles, but what it does is actually creates a vacuum. And for purposes of releasing or strengthening, I don't think that that's the most beneficial breath. Now, there are exercises like low pressure fitness exercises, which uses something similar, like it uses a vacuum technique in order to strengthen the muscles.
Mhm.
But that's something different than inhaling and sucking in. There's an actual technique to the low pressure fitness, which is way too complicated to go into right now.
I appreciate
But
that.
that inhale and sucking in is what we call in the PT world paradoxical breath. It's just not efficient.
Gotcha, gotcha. Ooh, okay. I felt like that was really important, so thank you for answering that.
No
I'll go
worries.
ahead and ask the other breathing question. So, kind of feel like you touched on this. How do different breathing patterns and trauma stored in the body affect the pelvic floor muscles? Could trauma and poor breathing cause things like painful intercourse or bowel issues because of the tension?
Oh, yeah, absolutely. That's a great question. So, yeah, as I touched on before with the breathing, you don't want the paradoxical breath. You want to get lengthening or an expansion of the ribs, which lengthens the diaphragm, the belly, the pelvic floor in order to release it. If the muscles are chronically tight, or contracted, it's going to be really hard to relax it when you're trying to have sex or when you're trying to have a bowel movement. So, absolutely, that can cause pain.
Got yeah. And so, what sorts of things would you recommend besides the stretching, the breathing, to address that kind of tense pattern?
The tension.
Yeah.
Um, I mean, physical therapy,
Yeah.
right? Because it's much easier to say, like, oh, just relax your muscles. Oh, just stretch. But then when you have guidance to relax here and not there, relax this way, do this breath, breathe here, let go this time, right? You have guidance. Someone's literally holding your hand, walking you through how to do this and when to do this and see physical therapist.
I love that. Absolutely. So that personalized guidance definitely does make a difference.
Oh my
And
gosh, absolutely. Because I have patients all the time who are like, oh, I bought this program online. And I'm like, great, how's it going? Yeah, still struggling, huh? So when you have that one-on-one care, someone walking you through and guiding you, it's so much easier because I mean, at the end of the day, we have knowledge and we've seen this before and we know anatomy and we know why you're having trouble. We know why you're compensating. We know why you have difficulty relaxing your belly, and we can give you guidance on how to best overcome those. So, one on one care is the best care.
I love it. As you said that, and as I thought back to the question, I wonder, do you personally have a psychologist that you refer people to? Because I would imagine with trauma, that would also be important to address.
Absolutely. Yes. So when I have someone with trauma, right, sexual trauma, even just physical or emotional trauma, I have a list of providers that I'm sending patients to, and I'm helping them develop like the team. And you need a team behind
Absolutely.
you so that because we're working for you, right? We're working for you. You have these issues and it needs to be addressed, and you need this person, and that person on your team. And if you don't have these people on your team, I can help you build your team, or maybe this person can help you find this other person to be on your team. But yeah, you absolutely need a team. Doing it by yourself is so hard, especially when there's trauma involved. It's really hard and you can feel very isolated and very lonely. But when you go to therapy, right, you have physical therapy to help you overcome the physical part of it. And then you have like a psychologist or a therapist or a social worker, someone helping you to overcome the emotional part of it. And I will oftentimes send patients to sexual or a sex therapist as well to overcome that aspect of it because there's so many layers to it, and you need help to peel back each layer.
I agree. Wholeheartedly agree.
Yeah,
Thank you for that.
you're welcome.
So, next question. I thought this one was really interesting. Could a menstrual cup cause some kind of a problem, like a prolapse, if it is not pulled out correctly with pinching the sides?
I've gotten this question so many times. I don't know how scientific my answer is, so this is my disclaimer. I don't know if I've seen any data to back this up, but how those cups work is they suction, right? They create suction, and the theory is if you don't break the seal, you don't break the suction and you pull it out, it's going to pull tissues with it and can potentially cause a prolapse. I'm not going to say that that can happen because, as I said, I don't know what the data is behind that, but that's the theory. I have never treated anyone who came with a prolapse because they fail to break the suction of their cup. It's usually something more traumatic on the body, like I pushed for 3 hours when I was giving birth, or I had a baby and then I got the flu and I was coughing for 3 days straight, or I have connective tissue disorders and again I was coughing for 2 days straight. There's usually something that happens, something a little more traumatic on the body where they someone might be able to pinpoint and be like, that was the moment when my prolapsed.
Got ya. Got ya. Okay. Good to know. Let's see. Next question. What exercises should be done for urinary retention?
Retention. Okay, so retention, that's interesting. I was expecting like exercises for urinary incontinence, but this is total opposite. So retention is when someone has trouble eliminating, like fully eliminating, uh, voiding their emptying their bladder, and relaxing the pelvic floor is going to be key. So going back to that tight pelvic floor, learning how to relax the muscles, maybe manually stretching the muscle by placing a tool or fingers inside and actually stretching the muscles, or stretching indirectly and breathing. Those are all ways of trying to manage that. And if those are unsuccessful, then they might need to use a catheter, self catheterize themselves just to eliminate, to make sure they're not having urine left in the bladder, because that can cause all kinds of issues like infections, and nobody wants that.
No. Nobody wants that.
Nobody wants
Exactly.
that.
Okay. So this one, I'm super excited to hear your answer on this one. Why do I get shivers or chills when I do pelvic floor exercises? It feels like something goes up my spine and then I shake and I can't resist it. It's an uncomfortable feeling. This usually happens at the beginning or if I hold longer. Is this normal? What causes it? And why do I feel so uncomfortable?
That is quite interesting, and I don't have the answer for that.
Fair.
I've never heard anyone complain about this. That doesn't mean that it's not a thing. I'm not dismissing this at all. I'm not sure. I'm going to be honest. I have no idea. I will say that the pelvic floor muscles are in close proximity to the sacral plexus. And there's a lot of nerves there. And there could be something to that. That's all I'm going to say. I'm not sure.
I always appreciate that sort of answer. And I think this is one of the types of questions that I know if someone were to bring to me and it was nutrition based somehow, I would say it depends. And it's probably a really good idea to speak to someone that you're working with one on one because there
Right.
could be so many different things at play here that someone who's
Different.
not as familiar with you and what you're experiencing really can't answer. But it sounds like
Yeah.
I would assume this person is working with someone because they mentioned pelvic floor exercises. So if
Yeah, I
you're
would
working
hope
with
so.
someone.
Yeah, I'm always surprised sometimes where some, and I'm not saying this person is like that, whoever asked this question, but sometimes I'm surprised, or I've seen on Facebook where someone has a question and they're asking the general like Facebook population, and someone will say like, go see a pelvic floor physical therapist or a doctor or someone else, and they're like, oh, I have one. And I'm like, well, why didn't you ask them? If you don't bring it up to your pelvic floor PT or your doctor or your nutritionist or whoever it is, how are they going to best help you? They can only help you if they know what's actually going on. So this would be, the response, the best response would be go back to your pelvic floor PT and explain what's happening. And hopefully they will have you perform it to see what's actually happening, and they might be able to be like, "Oh, what you're actually feeling is XYZ," or I don't know, let's look into this further, or maybe you should check back with your primary care doctor or something. You'll get some kind of response where, you'll have a better outcome, hopefully.
Yeah. No, that's really important, I think, for a lot of people to remember that what you said earlier, like your team is working for you and they really do want to see you improve. And
Right.
so if you're telling them what's going on, then you're going to get the best outcomes. And as someone who is a part of all of these amazing teams, how how do you help someone advocate for themselves or feel comfortable asking questions or bringing up because I think maybe this is why sometimes people ask these sorts of things online is sometimes the provider can feel like an authority figure and you maybe aren't so comfortable asking them like just in general how do you get up the nerves I guess in a way to speak to your provider honestly and openly.
Yeah, I mean, I'll say it makes me really sad that people feel like they can't speak up to their provider for fear of, I don't know, maybe a put down, or they're not going to get their questions answered, or they're just not going to get the time that they truly deserve. But, I'm a big believer in just asking the question. And my patients will give their disclaimer like, this might be a stupid question, and I'm like, no, there's no such thing as a stupid question. If you have a question, I don't care how simple or stupid you think it is, please just ask me, because as I said before, that's the only way I'm going to be able to help you is if I really know what's going on. And if you're not understanding something, I failed. I failed you in some way. And I hope that you don't feel intimidated to not ask me a question. So when it comes to other providers, I know some doctors are not as nice, or other providers are not as nice, and there's not enough time, and whatever the case might be. But just ask the question,
Mhm.
write it down. It helps to write it down ahead of time so that when you go in, you can say, I have some questions. Do you have some time to answer them for me? And hopefully they'll say, yeah, go ahead, shoot, right? They'll sit back and they're all ears. Or maybe they'll say, I have other patients, maybe, but you can ask the nurse or this other person who assists me somehow. And then you might still be able to get your questions answered. And maybe if it's something that the doctor needs to answer, then maybe they say, okay, well, let's schedule time to get your questions answered, right? Like, hopefully that's happening. But if you feel like you can't speak to your provider or they're not answering your questions and they're, you know, blowing you off or not giving you the time that you deserve, maybe see another doctor, another provider, I'm a big believer if this person isn't working out well, go to somebody else.
And I feel like we could end the conversation here because that's I feel like that's such an important takeaway. Like, if they're not
Yeah,
serving your needs, then it might
go
be
to
time to
somebody
look
else.
for someone else. Yeah.
Absolutely. It's like, would you have a friend who you didn't like being around, who didn't give you the time of day? No, you wouldn't talk to that person. I'm not saying your doctor is your friend, but it should be someone that is going to be there to help you. Like, that's their job. And if they can't do that for you, they're not serving you well. You need to find someone who can do it because I guarantee there's someone else out there who will give you the time of day, who will serve you the way they should be.
Absolutely. Thank you for that. Thank you. Okay, so we're at our last three. How does spine misalignment affect your ability to get pregnant?
Ooh, mm, that's an interesting question. So I don't know if it does and I will say because, someone who has scoliosis, right? Their spine is curved, they can get pregnant. So I don't see a reason as to why that would be an issue. So if someone's having trouble getting pregnant and they're worried about their spinal alignment, that's probably not the reason why they're having difficulty getting pregnant.
Mm.
And then I would refer them to a specialist who can run some tests and ask some questions and, come to a better conclusion as to what is actually going on here. Because for someone to think a spinal misalignment is causing difficulty in getting pregnant, or they're being told that and they're working on, correcting that alignment and still not getting pregnant, I'm concerned that they may be wasting their time in the
Mhm.
wrong place and to find help with a specialist, a reproductive endocrinologist who can do the appropriate tests to figure out why they're having difficulty getting pregnant.
Good answer. Good answer. Okay. Now this one. Actually, I added this one because I'm nosy. I mean, curious. But then someone asked it, and I was like, okay, cool. Is there anything that can be done through physical therapy to correct a tilted or retroverted uterus? But before we get into that, like, what are those, and why do they exist?
So, a tilted or retroverted uterus is when the uterus doesn't sit, nice and upright the way it should. It may be tilted backwards or it may be tilted like to the side. And it could be weakness in the ligaments that hold the uterus in place. And what can be done about that? I believe there are some therapists who, like I, for example, practice what's called visceral manipulation. And that's where we manipulate or mobilize, or fancy way of saying encouraging the organs to be in their right place. So we can try to encourage the uterus specifically to be where it should be. Um, but I don't know of any studies that will say definitely this will do this or this will correct that. Some providers or medical doctors don't believe that that causes any issues. Um, some I don't think anyone will even try to fix it. I'm not going to speak for any OBGYNs or any pelvic surgeon doctors. But last time I checked, I don't think anyone was doing any surgery or anything to correct that. And, that might be an issue if someone is having trouble um, or like with birth, right? Like birthing a baby. It may pose an issue, but probably not. And personally, my uterus is it shifts. Like it goes from here to here, it does things, but it's never stopped me from having children. And I will say I've had two C-sections and one vaginal, and everybody came out okay. So
Well,
there's
that's
a
good to
way
hear.
that they come out. They come out one way or another.
Good
But
to
yeah,
know.
some providers do practice visceral manipulation, and they can encourage the organs to be in their right place, um, with time, or
Mhm.
maybe not. It might not, because like I said, we're just encouraging.
Gotcha. Okay. Awesome. And now for our last question. Which specific pelvic floor exercises should be done before, during, and after, and which should be avoided?
Ooh, this is a loaded question.
It is.
So you know what? It depends. It really does depend. But if nothing is going on, there are no issues, no leaking, no pain, uh, constipation, like there's nothing going on. Generally, before pregnancy, right? Before pregnancy,
Mhm.
one could benefit from just finding the pelvic floor muscles. Where are they and what do they do? Right? That's always beneficial for anyone. And if they're weak, you have time to strengthen it. If they're too tight, you have time to relax them. So just finding those muscles and finding out what it's doing and then correct whatever needs to be corrected during pregnancy, um, pretty much same thing. Just maintain what you got going. Towards the end of pregnancy, though, so if someone's doing strengthening exercises during pregnancy, that's like early on in the pregnancy. Towards the later end of the pregnancy, you want to teach your muscles to relax because in order to birth the baby through the vaginal canal, those muscles are going to need to learn how to relax. And you don't want to try to teach your muscles how to do that the day of the concert. Like you want to practice beforehand, right? So you want to teach your body how to relax towards the later end of your pregnancy. And I will often recommend what's called perineal massage during the later end of the pregnancy, which is just getting your fingers in there and stretching because if you're planning on having a vaginal birth, baby's head will be doing that, and you don't want that to be the first time your muscles are stretching, essentially. And then after pregnancy, day one, you can start doing pelvic floor exercises, whether you had a C-section or a vaginal birth. If someone tore at the perineum, they can do pelvic floor exercises to help bring blood flow, which will stimulate healing. C-section, they can go ahead and do that too. Again, it just promotes healing and that reconnection of here's my brain. I told my brain to do this. Here's my deep core. This is what it does, right? You're just reteaching your body again where those muscles are and what to do with it. And then postpartum, meaning anywhere between as soon as they give birth and forever. If someone is having pelvic floor issues, right? Like they're doing their strengthening exercises and it makes their issues worse, then strengthening is not what you need to be doing. Maybe it's relaxing. If relaxing and stretching is causing issues to be worse, then maybe strengthening is what they ought to be doing instead.
Beautiful. Great, great, great.
And
Oh,
yeah,
go ahead.
I think I talked about what should be avoided too, right? Did I address that?
Well, yeah, because you said if it's
Yeah,
this, then do that, and if it's that, then do
right.
this. I love that because I think we need
Isn't
to be
it? Yeah,
reminded that it's about finding kind of that middle place, that like
right.
balance. It's not, you don't
Exactly.
want to be in either extreme. You want to be,
Exactly. You don't wanna be too tight and you don't wanna be too relaxed or too lengthened. You wanna be somewhere in the middle, and you wanna know where you are, you know? This is why I want women to come in before they get pregnant, so find out, like, "What are my muscles doing? What do I need to do?" So
Mhm.
that when things change, because they will, you can recognize, "Oh, this is different. Oh, it's harder for me to engage my pelvic floor muscles," or
Love
whatever
that.
the case may be.
I love that. Good, good, good. So we all need a baseline.
Everyone needs a baseline.
You heard it here. So I'm sure that after hearing all of your lovely answers, people are going to want to know more about you. So where can they learn more about you and your services?
Yeah, so my website is lotuspt.com, where pretty much everything is on there. And I'm also pretty active these days on Instagram, Lotus Pelvic PT. Not so much Facebook, so that's not there. Pretty much my website has everything.
Is there a link on your website to your podcast?
Oh, there is somewhere, but it's probably hidden pretty well. So I need to do a better job of making that more obvious. But yes, my podcast is The Kegel Room, and that's available on iTunes and pretty much anywhere. But it's fun. It's really fun. I pretty much talk about like this and more, but with other providers as well. So it's fun. We get to talk about a lot of different things.
Awesome, awesome. So I'll make sure to link to all of that below. So make sure that you go to the description box and check out all of those links. Thank you again. I so
Yeah.
appreciate you.
Yeah, this is fun. Thanks for having me.